Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about common eating disorders. Eating disorders are conditions related to severe eating behaviors which negatively affect health and emotions. They have excessive concern about weight, body shape, and food, and those with eating disorders often deny that they have a problem. They are the third most common chronic illnesses in adolescents, and it is estimated that 24 million Americans of all ages meet the criteria for some form of an eating disorder. They usually start in teens and young adult ages, especially in females. The three most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anyone can develop an eating disorder. There is no known exact cause for developing an eating disorder, but there are some things that have correlations. It could possibly be biological, such as being a female, having a first-degree family history, and there could be brain chemical changes. It may be social, due to teasing from friends or family about our body shape and sizes, peer pressure, and media images. It could be related to a sports or a job pressure, such as gymnastics, wrestling, and modeling. It could be due to stress from abuse, death, or a new job. It could be emotional health issues, such as low self-esteem, perfectionism, impulsive behavior, and the desire to be in control. It could be from long-term dieting, as this may lead to starvation or the urge to binge eat. It could be learned behaviors, as food is often used to soothe us at younger ages. Eating disorders are more common in industrialized societies as there is an abundance of food and thinness is often considered attractive. Eating disorders are often associated with other mental health disorders such as depression, anxiety, substance abuse, and obsessive compulsive disorder. Experts are not sure which precipitates the other. Anorexia nervosa has a lifetime adolescence prevalence of 1.7% in females. One study showed that those with anorexia have an 18% higher mortality rate than those without any eating disorders. Characteristics of anorexia include distorted body image, thinking they're overweight even when they're dangerously thin. They often think that thinness equals self-worth. Intense fear of gaining weight, and they often refuse to eat, especially in front of others. Restrictive calorie intake, and compulsive exercising. Some may also use diet aids, laxatives, or vomit even after eating the smallest amount of food. Some effects of anorexia include anemia, constipation, osteoporosis, organ damage, cessation of menstruation, thinning hair, soft hair all over the body, irregular heart rhythms, social withdrawal, irritability, and insomnia. Bulimia nervosa has a lifetime adolescent prevalence of 0.8% in females. Characteristics of bulimia include eating excessive amounts of food in short periods of time, known as a binge, then purging the calories to prevent weight gain. This may be done through vomiting, using laxatives, enemas, diuretics, fasting, and exercising. Those with bulimia often have a normal weight or may be slightly overweight. They have an intense fear of gaining weight, feel lack of control over their eating, and may judge themselves for self-perceived flaws. Effects of bulimia include sore throat, eroding tooth enamel, acid reflux, cessation of menstruation, heart attacks, dehydration, shame, and guilt. Binge eating disorder has a lifetime adolescent prevalence of 2.3% in females. Characteristics of binge eating disorder include eating excessive amounts of food in a short period of time, known as a binge, but not purging the calories. They eat until uncomfortably full, eat when they're not hungry, they may eat alone, they feel lack of control over their eating, and they are often overweight or obese. Effects of binge eating disorder include high blood pressure, cardiovascular disease, diabetes, sleep apnea, obesity, GERD, guilt, shame, and embarrassment. There are many consequences to having an eating disorder. It can lead to severe health problems, depression, anxiety, obsessive compulsive disorder, suicidal thoughts and behavior, growth and development problems, social problems, substance use, work and school problems, and even death due to starvation, suicide, cardiac arrest, and complications of new conditions. Here are some red flags that you or someone else you know may have an eating disorder. You may be skipping meals and making excuses for not eating or not eating around others, may have an overly restrictive diet. You may find large amounts of snacks hidden, such as under the bed or in a dresser drawer. You may find large amounts of empty food wrappers or containers. The person may be withdrawing from activities. They may have an excessive focus on weight and shape. May be constantly checking themselves in the mirror looking for flaws. Often eating large amounts of sweets or high-fat foods. Use of weight loss substances. Excessive exercise. They may have frequent weight changes. They may wear large or baggy clothes to hide their body shape. May have loss of tooth enamel or calluses on their knuckles, which are possible signs of repeated vomiting. They may go to the restroom often during or immediately after meals. May be eating a lot more food that is considered normal. May have emotional expressions about food and eating habits. It might be difficult to see the signs in others as they may become experts at hiding their behavior. Seek help if you have symptoms or think you have a problem. And if you suspect a problem in family and friends, seek help for them as well. Approach them and be supportive and do not judge or blame anyone. The diagnosis of eating disorders is based on signs, symptoms, eating habits, and specific criteria listed in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM. A physical exam will be done to rule out other medical causes of eating problems. Vital signs will also be checked. Tests may be done, such as lab tests to check for electrolyte imbalances, high cholesterol, diabetes, and blood cell counts. An X-ray may be done to check bone density, fractures, pneumonia, and heart problems, and an EKG to look for heart irregularities. A psychological evaluation will be done to discuss thoughts, feelings, and eating habits. Treatment for eating disorders is often long-term. The sooner that treatment is started, the better the outcome. The treatment team may include a psychologist to treat underlying mental health issues, a physician to rule out other illnesses and monitor and treat any current illnesses, and a nutritionist or registered dietitian to assess and improve nutritional intake. Types of treatment may include nutritional rehabilitation to change eating habits and develop healthy meal plans, medical monitoring to treat medical complications and conditions, and psychotherapy, such as a family-based therapy, in which the whole family is involved in following the healthy eating patterns and they learn how to monitor the family member. They may also use cognitive behavioral therapy, or CBT. With this, they learn to monitor and improve eating habits and moods, develop problem-solving skills, and learn healthy ways to cope with stress. They may also use interpersonal psychotherapy to improve skills in relating to other people. Medication may also be used. Antidepressants may be used for bulimia and binge eating disorder. The SSRI fluoxetine, or Prozac, is FDA approved for bulimia to decrease the binge purge cycles. It can also be used to treat other mental health issues regardless of the type of eating disorder. Lisdexamfetamine dimesylate, or Vyvanse, is FDA approved for binge eating disorder to decrease the binge eating episodes. Complementary therapy may also be used in conjunction to help reduce stress, increase relaxation, and well-being. This includes acupuncture, massage, yoga, and meditation. Support groups are also helpful, and hospitalization may be used to aid in severe or life-threatening issues. Goals of treatment include establishing healthy eating patterns, maintaining healthy weight, treating medical conditions, and addressing emotional and psychological issues. There is no sure way to prevent an eating disorder, but here are some suggestions in helping to prevent them in children. Do not diet in front of your child. Have more frequent family meals. Ensure open communication with your child. Reinforce positive body image, and talk with your doctor about any questions or concerns that you may have. The road to recovery from an eating disorder may be long. Follow the treatment plan and go to all therapy sessions. Follow the meal and activity plans. Be sure to eat food from a plate and not from a bag so as not to overeat. Also, do not eat while distracted, such as while watching TV, reading, or doing homework, as this can also cause you to overeat. Take any vitamin and mineral supplements as recommended. Avoid weighing in or checking yourself in the mirror often to prevent slipping back into old habits. Spend time with family and friends. Isolation may fuel old eating behaviors. Find positive role models and be around people who will lift your self-esteem. Develop new hobbies to find enjoyable ways to spend your time and keep busy. Learn about your eating disorder. Go to follow-up care during times of relapse, as it is common to relapse. Go to your healthcare providers when you first notice any return of the behaviors. I found this poem from the My Purple Dreams blog to sum up everything nicely. Count your blessings, not the calories. Weigh your options, not your self-worth. Starve your self-hatred, not your body. Hate the disorder, not yourself. This concludes the eating disorders presentation. If you have any questions or concerns about this for yourself or for others, please seek help from a trusted individual. Thank you.